Joining us now for more is infectious disease specialist at South Shore Health and ABC News medical contributor Dr. Todd Ellerin. Dr. Ellerin, thanks for being with us as always. So what do you think of what we just heard from James, the UK government's plan, and I get it, to relax a bit around Christmas. I even lived in London during Christmas, and it is special there as it is everywhere. How do you think that is going to impact cases there? You concerned?
I am concerned. I think the issue is, first of all, a couple of things. The United States is not the UK. Remember, we're 6 times larger. And when you look at the number of cases in the UK right now, there's about 11,000 a day, for example. Even if you note that they're 6 times smaller than us, that would be like us having 66,000 cases a day. But guess what? We have 300,000 cases a day. So, we're just not in the same place right now where we can relax things. Am I worried about the UK and an increase in cases, hospitalizations, and deaths with the possibility of another super spreading holiday? Absolutely.
So the UK was the first country to approve of a vaccine. They're very proud of that, and they're getting it now through their healthcare system, through their senior population day by day. What can we learn from how the UK approached this vaccine as it rolls out here in the U.S.?
Yeah, well, again, obviously UK is very experienced at rolling out various vaccination campaigns. This will be no different. I think the couple of severe allergy cases that occurred have slowed things down a bit, right? Because they're monitoring patients for 15 minutes now after receiving the vaccine, and that's having issues, especially in like family practitioners clinics, where you can imagine that you have a more limited space than you might in a large hospital system like I work in. How can you have many people coming in and keep them physically distant? So, there are definitely going to be hiccups, and this is a very challenging process, but we're going to figure it out over time. We're going to make sure around the world that the majority of people who want this vaccine get it.
And the FDA now in this country on track to authorize the Moderna vaccine, as we heard earlier, as early as this week. So here's a question people might have. Could the vaccines be combined? Let's say you get a Pfizer shot, and then for your second shot, could you do the Moderna one?
Right, Terry. I mean, I think it's a good question. I think the answer right now is no, and that reason is because, think about it, we're basing the evidence on the phase 3 trials for both companies, and both companies use the exact same dosage of vaccine as they did for the first dose and the second dose. So right now, we don't want to take the Pfizer vaccine first and the Moderna vaccine second. If you're starting with Pfizer, you want to end with Pfizer. If you're starting with the Moderna vaccine, you want to end with that. Very exciting data to hear that the FDA has scrutinized the clinical trials and heard that the efficacy is 94% after 2 doses, and that, remember, 30 cases of severe disease, 0 in the vaccine group, all 30 in the placebo group. I mean, that is huge.
It really is. The tremendous advances finally giving us some light at the end of the tunnel. Dr. Todd Ellerin, thanks as always.
Thanks, Terry.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.